Hello my friend, I hope you are fine. Today I will explain the TF adaptive system from Cybron Indo. This is the system is like a traffic as I will talking about it and explain it. Its properties, it combines strength and flexibility, patent TF nickel titanium twisted file, adaptive motion technology of the elements motor, safe and accurate and efficient cleaning and shaping for the root canal. Anequi adaptive motion technology, deliver rotary when you want it and reciprocation when you need it. As we see here, this is the first file, it's a green in color. There is three files for small. They said that the file for SM1, SM2 and SM3 for small files and small canal, and ML1, ML2, ML3 for medium and large canals. I will explain that and I will refer to the photograph for this system. It's the endomotor, it's a special endomotor system, and as we see here, we will start like we see here, like this motion. This motion is about 600 degree clockwise when it's no loaded. When there is a loaded, it's about 370 degree when loaded clockwise, and reciprocation 370 clockwise and up to 50 degree counterclockwise when there is a loaded in the application. As we see here, the application where there is no loaded, as we put it inside the canal, there is like that, there is slightly loaded. It will continue to its rotation in our canal. After that we will continue with for a cleaning. After our expansion for about 8 file, K file number 8 and number 10, then number 15, then we will start with the green file. As we see, it's for a small canal SM1. It's like a traffic signs, green for starting, yellow for medium, or maybe we can stop with that, and red for end. There is no any loading, there is no the requirement for counterclockwise. It's smoothly making the glide path inside the canal. As we see here, we can see the clean and the clean canals. The path file is very smoothly and the debris will extract with easily motion. We can regard that there is no apical transportation or any problem or any zipping or any problem inside the canal walls, and smoothly contact with the canal walls, the fine shaping of the canal. This is for the green one. For the SM1 we use it like that. Then I will change to the SM2. This is also for the small canal. The properties of this file, I will speak about it. They said that is the adaptive motion technology. Change the motion of the file based on the applied load, better file control and reduce chance for breakage, provide a reflex torque control, adapts to your technique throughout the procedures, rotated the file clockwise and depend on the load. The system react and adapted to a counterclockwise reciprocation motion when there is a loading. As we said at the beginning, alternative rotated and reciprocation motion reduce the stress, and G, avoid the screw in effect, screw in the canal effect. As we see, I changed to the yellow file, SM2, like that. And normal load in the control, the file rotate in short interrupted bursts of 600 degrees clockwise rotation. This allows the better cutting efficiency and remove the debris. As we see here, our working length for our canal is about 10. Smoothly path file and smoothly glide path motion with safety. There is a good motion inside the canal, as we see here. There is no zipping or any apical transformation. Advantage of anechoadaptive motion: reduce the risk of the intracanal failure without affecting the performance. Automatically selected in real time and selected and most efficiency file movement based on its current loading. And adaptive motion technology also help to reduce the chance of post-operative pain and the inflammation associated with the pushing debris through the apex. This is an important note for our patients for reducing the post-operative pain. As we see here, I will change to the SM3. SM3, like that, it's a red in color. This is for a large canal, or we can stop for yellow, for green and yellow. Either if there is a small canal, or if there is a slightly large or interrupted canals, or there is a problem in our canals, we can use the SM3. SM3, as we see here, our important things is irrigation, and then we will use it. It's a smoothly tip can glide path formation without any zipping or any transformation, like you see here, the contact with the canal walls. The most important thing, there is no pushing for the debris for the patient to avoiding the post-operative pain. Thank you for your watching and have a nice day. Thank you. Goodbye. Bye-bye.